remember once in negotiations when they were talking about the changes in healthcare and things like that, and they said, you cannot predict the future. To which I said, yes, you can. If it's written in a contract, you can predict the future.
Over 40 years ago, Oak Ridge, Tennessee nurses and hospital workers took an historic step. We chose to unite with the Service Employees International Union, the largest healthcare union and the largest nurses union in the country. As members of SEIU Healthcare, we are a powerful union of over 1 million hospital and long-term care employees.
It gives us tremendous political power across the United States. It lets the staff, the nurses, the people who are SEIU members really be the ones to sit down and say, what are the specific challenges that we face? How can we face them together? And SEIU has really set the standard to say, we want to do it in a positive way. We want to work with employers and not against employers, and really kind of change the whole mindset of what being in a union means.
The number one priority for all the nurses I have ever met is to be able to give the highest quality care that they could possibly give. It is not only our right, but it is our responsibility to be in there to take care of the patients, and that's the confidence that a union can give you, that you're not alone.
Our contract at Methodist Medical Center in Oak Ridge is one of the strongest contracts in the South, uniting hospital employees from every unit and job classification throughout the hospital.
Having a union at Methodist means that we have good standards, good patient-nurse ratio. We're able to give the patients good quality care.
Here at MMC, in our contract, we do have language that sets limits on how many patients a nurse can take in a particular area or on a particular shift. We need consistency. We need to know that day after day, shift after shift, when we come in to do our job, that we will have adequate staffing to do that. The thing that was happening in the hospital when we first got our acuity language was that there was no consistency. You may have one type of staffing level one day, another type of staffing level another day, and that is why we found it so important to have the acuity language in the contract, that no matter what kind of manager you had, no matter what day it was, be it a regular day or a holiday, that you had language to address the needs of the staff and the patients.
Having safe staffing standards in our contract provide for minimum staffing levels. And with many nurses anxious to fill these positions, we can prevent the use of mandatory overtime, which is prohibited in our contract.
They definitely need a union. You definitely need that support for so many different reasons.